At Blue Shift Medical Licensing, their goal is simple: to have you do as little as possible. The expert team takes care of the entire licensing process, from handling all the paperwork to ensuring every detail is perfect. They even track your renewals, so you'll never miss an important deadline. With Blue Shift Medical Licensing, you can relax knowing that your licensing is in the hands of certified professionals. Let them do the work for you. Mention this podcast for a 5% discount. Find them at blueshiftlicensing.com. You are listening to Practice on Purpose, where physicians can explore how to set up their career on purpose from the very beginning to stay connected to their purpose for their entire career. I'm Dr. Nicole Eull, a health psychologist with decades of experience in healthcare, from the front lines of a level 1 trauma center to the leadership in one of the largest healthcare systems in the country. I'm passionate about physician well-being and creating mentally healthy workplaces. If you want to thoughtfully establish a career that aligns with your values and passions and ensure a long and rewarding life as a physician, then you've come to the right place. Our guest today will be talking about salary negotiations, and I know that this is going to be a really popular episode with lots of interest. So our guests are Ethan Nkana, the talent agent for doctors with Rocky Mountain Physician Agency, and Julie Schmidt, a financial advisor with Northwestern Mutual. Welcome to both of you.
Thanks for having us.
I am delighted to be here. Thank you for having us, Dr. Eull.
So I'd love for you guys to take a minute. Why don't we start with Ethan and just have you introduce yourselves and give a little background about you?
Yeah, absolutely. First and foremost, I'm so grateful to share this platform with you. And what resonated with you, with what you said early on, was practicing with purpose. And it made me think back to this weekend as I was speaking with the National Medical Association about being paid fairly for your work. And so my purpose is honoring my mother's legacy as an anesthesiologist by helping doctors be whole, happy, and healthy by negotiating a schedule that honors their lifestyle, support that's adequate and safe in their practices, and pay that is fair for their effort.
That's great. Thank you. And what about you, Julie?
I'm so happy to be here. Thank you for having me. Just like Ethan was saying, so as a financial advisor, I think for me, working with doctors really comes back to just wanting to give back to people who give of themselves every day. And I was a teacher actually for the first almost 2 decades of my own career, so also a very giving profession. And I think education really is at the center of the work that I do with my clients. And so that translates to working with physicians perfectly. And I think this topic is so incredibly important with the way that things are in medicine right now, in terms of how physicians are feeling with burnout and things like that. So I'm happy to be here to have this conversation.
Great. And Ethan, you had mentioned that you do this work in part as being inspired by your mother. Can you tell me a little bit more about how you got started in this field?
Yeah, I'll be happy to. And I talked to my mom an hour ago about a recent educational session. So
if you're listening now, hi, Mom.
Yeah, I'm going to send this to her as soon as it's published. So I know she's going to be excited to listen in. But when I think back to where this idea started to really originate, it was around high school and college when my mom started to have conversations with me about, what do you want to be when you grow up? And she would tell me, you need to get a job in healthcare because you'll always have a job. Mm. What she didn't quite foresee is that in 2019, I would get laid off from a leadership position after 15 years working as a hospital executive. Mm. And so now I've pivoted my career to take everything I learned working on behalf of hospitals against doctors now for the benefit of doctors. And that really started with my mom planting that seed of getting a job in healthcare. And here I am 15 years later working for people just like her.
Mm-hmm. Cool. So Julie, tell me a little bit about your work with physicians and some of the programs you've hosted for physicians.
Sure. So, just to give a little bit of context, I always wanted to be either a doctor or a teacher. I actually was pre-med when I started college, and I worked in a hospital for 8 years. And a physician that I worked with actually really discouraged me from becoming a doctor if I wanted to be a mom, which is sad, but true. And so I've always been interested in medicine. I've always been, to some degree or another, kind of involved in this work. I even almost went back to medical school when I was 30, funnily enough. And now my own children are growing, and my daughter, who's 16, has a tremendous interest in medicine. And so I started learning about, how to work with physicians and the unique planning needs physicians have from the financial advising standpoint. And I started learning more and more about the wage gap for women that exists in medicine, which, varies across specialties, but can be pretty significant. And I don't want that for my daughter. I don't want that to be the case for her as she grows and develops in her future.
Right.
So that started motivating me to just keep learning and understanding what the women that I plan with are kind of up against, and just how to be a force for good in that way. And so some of the things we do with physicians is we speak to medical students at the medical colleges locally, working on expanding outward with that as well to other areas of the country. We do a lot of things online. We just hosted an open Q&A a couple weeks ago through LinkedIn, just to let people have that platform to ask questions. Because as we know, physicians and residents, fellows, and students are all tremendously busy. So just trying to find time where they have time to ask questions is really important. And I think, when it comes to just how we approach this work, education is always at the forefront of what we're trying to do, and just helping people be informed. I think education is really equates to being empowered. And so for me, that's like really important to me, is that my clients feel empowered to make good decisions, and that we can help with that through education.
So giving those new professionals an opportunity to hear and think about how they can set up a good financial portfolio and a good, successful financial life, right?
Absolutely.
Yeah.
Yep.
So Ethan, what are the basics here? So we were talking about salary negotiation. You are an expert in this in the medical field. So what kind of things are on the table that physicians can negotiate? What are the things you can negotiate?
I think of it as kind of the holy trinity of the big three that most doctors have some interest in, and more importantly, that impacts your life in a significant way. So first and foremost, your compensation package. That's, of course, that big, sexy six-figure number that we all look for, but it's also your bonus compensation, education, loan debt support, things like that. Secondarily, I think about your schedule and your lifestyle.
Yeah, for sure.
Do you want to be home to see your family every day? Some doctors are single and living their single life, so they want to focus on working as much as possible to make much money as possible. So your schedule, finding a schedule that fits your lifestyle, is usually the second primary consideration. And then the third leg of the tripod is support, administrative and clinical. So, when you're in your practice, yes, you're providing care as a physician, but you rely on a team of people around you to facilitate that. Your MAs, your PAs, your practice manager. And so making sure that everybody is in the right position to support you to be successful, that's how you show up as your best self, right? And then ultimately, patients benefit, right? When doctors are not stressed, when you're well fed, when you're well rested, patients benefit. And my job is to help articulate those ideas and those values into your contract.
Yeah, that's such a good point, because I don't know how many physicians are asking those questions, especially at the beginning of their career, if they're asking the questions around who is going to be there to help me do the best job possible. And then to your point on the second tier or the second pillar is this idea of schedule. Like, you might be signing up for a job that suits your need in the short term to maybe pay off loans or hustle and get some money and feel like you can feed your family again. And then later on, you might want something different when you have young kids or school age kids, or you have other passions you want to pursue. Is maybe even asking, is there some room for me to switch or shift or change and schedule later, So
You're absolutely right. And doctors are not a monolith. So not every doctor wants a schedule that looks a certain way or is that's structured a certain way. And so it's important, similar to when doctors are interacting with your patients, it's important first to diagnose and understand what's important to you.
Mhm.
What lifestyle do you want to live? And then how can we take those ideas and translate them into your contract in a way that your employer is going to understand? And it goes back to everything that you said earlier, Dr. Eull. We want to prevent burnout. I want my doctors to be as happy and healthy as possible.
Right.
But when they are working ungodly shifts, when they don't have the support they need, when patients can't get in for months, doctors are tired. And my job is to help provide a life raft or a lifeboat for them as they're treading water out in the middle of the ocean.
Mm-hmm. Right. So, Julie, are there, we're talking about things that might come up, things like loan forgiveness because you work at a place where you qualified for that, or they're going to offer to repay your loans, or they're going to give you a signing bonus, or you get straight productivity so you can earn more if you work more, all these different things. Are there any bargaining points that you feel like have better short-term or long-term, financial benefit that maybe not so obvious to the average person who doesn't know a lot about finances?
Sure. Well, that's a good question. I think one of the top things that we help people really kind of like hash out are what your student loan repayment options are. I think if you're working in a nonprofit environment like a hospital, for example, that is a not-for-profit, and you qualify for PSLF, that's usually going to be the public service loan forgiveness, I should say. That's usually going to be a good option to take because it's going to lower those student loan payments, which is going to free up money in that monthly budget, especially like for residents. Dr. Eull, you and I had talked about how, residents are just now starting to get a taste of like, okay, I have a salary. They've been in school for so long, not really living on much money. So once you get to residency, you really need to start thinking about what your student loan repayment options are. And so if you have access to PSLF, that's usually going to be the best option. However, once you're through residency and you have job offers, if you end up, after talking to Ethan, for example, taking that for-profit offer, if you're working in an institution that is not a not-for-profit, I should say, there may be an opportunity where they offer loan forgiveness. And so it's important to weigh out if their loan forgiveness offer is good to take the way it is, or if it's better to try to negotiate what they're offering in loan forgiveness in salary instead. Because salary you're going to keep for a longer period of time, obviously. So, when it comes down to like what's better short-term or long-term, it's very dependent on the individual and the situation and where they're going to be working. A lot of those, features end up being different based on what job they take. So I think, having somebody that you can trust and will sit down and kind of like weigh out the options for student loan forgiveness is really important. In terms of like bonus money and, things like, Ethan was saying in terms of production bonus and things like that, it really comes back to what that person's goals are. I was just speaking with a non-traditional student this week. She's got 3 kids and she's, just finishing her residency. So for her, that money is going to look more like putting it into college funds for kids, right? But for somebody who's young, maybe they are dying to take a huge vacation and you want to prioritize living life too, just for that aspect of work-life balance and finding joy in what you do. So being able to just kind of balance those priorities and understanding from our perspective what's important to that person is really going to depend on the recommendations we make.
There's one thing. I have a friend who works in hospital administration, and we were discussing this recently, and he said, hey, what a lot of people don't know, and that some people have been asking for is, let's say you're in a position where you don't have loans to repay. Well, God bless you. Good for you.
Right.
But a lot of people in the medical profession have very massive loans to repay. But if you happen to be one of those fortunate people who does not, for whatever reason, you're super duper smart and attractive and you got an amazing scholarship, whatever the case may be, that you can ask for a signing bonus of an equal value. So if you had a loan, if they're offering loan repayment, you can offer for a signing bonus or maybe even a bonus that's being paid out over time. Ethan, have you ever heard of anyone doing that?
Yeah, absolutely. Absolutely. That's a very smart strategy.
So, well, hopefully we pass that on to someone out there who is good enough that they didn't have any loans. Amazing for you. So, Ethan, I think we, in a previous conversation once, talked about the mental barriers that come into play. I know that I have this mantra that's sort of silly, but I say, if you don't feel like you're going to throw up a little bit when you say the number you think you're worth, then you're not asking for enough, right? So not to say that we're trying to gouge people for that every last dollar, but that often we undervalue ourselves, right? So what do you think are some mental barriers that physicians have around salary negotiations? Like as you're working for your clients, what are you coming up with?
Doctors are helpers first. They're not business people. And so when they think about the job that needs to be done, they're thinking about how can I create the best potential outcome for the patients that I'm treating.
Right.
That's the doctor's focus. As a hospital executive, our focus is how do I create more revenue? How do I lower expenses? And yes, outcomes matter. So how do I provide the best care? But whittling down the visit duration, the support that you get around the patient, or just kicking doctors out of the process altogether and hiring NPs and PAs to do the work. And so I think that there is a mental barrier where doctors are tired. Doctors are beat down and have been discarded. Doctors used to be the tip of the spear in healthcare. And now, if you ask anybody who knows anything about the economics of healthcare, it's insurance companies, it's pharmaceutical companies that are driving decisions in healthcare. And so I think doctors are so focused on, I didn't get into this to make money. I didn't get into this to be wealthy. I got into this to care for my patients. And that's what I want to do. And it takes someone like me to point out to doctors, hey, it's not in tension with your Hippocratic oath to be paid fairly for your work. Because while you're suffering and sacrificing your time, actually really quick, I talked to a rheumatologist out of New York who got her pay cut by 50%. I don't care how much you make, 100,000, 600,000, doesn't matter how much you make, 50%. This doctor called me and said, Ethan, this happened a year ago. I'm ready to fix it, but I don't know what to do. So this doctor had been suffering in silence for a year. And I know why. It's because of her patients. She didn't want to raise a fuss or get sideways or, God forbid, think about going somewhere else because her patients need her.
And she'll abandon them, right?
Yeah. And so I often have to remind doctors that, yes, it is extremely difficult to think about the idea of change, and we'll make it worth it for you because you've earned the right to be paid fairly for your work.
Right. I think we all, it is a different kind of field. When you are in healthcare, they always say, oh, no one's going to say anything about your last spreadsheet at your funeral. But lots of really good physicians, their patients do come to their funerals and they do write letters to their families and tell them that time that they spent holding their hand at the bedside or or listening to their questions made all the difference in their life or their children's lives. And so we can't quite dismiss it like, oh, it's just a job. It is really, truly, in most cases or many cases, life and death. So it does have that gravity that you're talking about, that heaviness where you feel like you don't want to abandon your patients, or that in some cases your patients are very poor and underserved and they don't have a lot of access to great health care, or they don't have access to great information, and you feel like you're the one who can give it, and you don't want to have to put yourself as the collateral. Like, if I don't get this, I'm out of here. So there are organizations out there, I know I've met some of them, that are really committed to celebrating their physicians and are offering maybe some more forward-thinking, new, modern, interesting kind of benefits. Have either of you heard of any cool benefits or new, different kinds of things that people are offering to incentivize physicians to come work with them?
I'd say one of the incredibly valuable offers of compensation is really to piggyback on what Julie said a moment ago about the education loan debt assistance. So she was spot on saying, hey, if you prioritize PSLF, they're going to have those loans forgiven after 10 years, 120 on-time payments. Awesome. And what I do with doctors is I will have them, in addition to that, with a nonprofit employer, also ask for education loan debt assistance. It's rarely included in the first draft of the offer letter, the LOI, or the employment contract. So what I do is I include some very standard language we have, which says that the employer will pay support, financial assistance to the doctor for the period of 2, 3, 4 years, usually in the amount of somewhere between $25,000 and $45,000 per year. So on the upper side, that's maybe $135,000, $160,000. But again, that's one of those hidden gems that if you don't ask for it, it likely will not be included.
So that's sort of, to be sure I understand that's like a bridge payment to help you get through the time when you do have to pay.
Exactly. Yes.
Okay. Oh, that's so interesting.
So while you are paying during a nonprofit, while working for a nonprofit, they're also helping you pay down that balance. So maybe it ends up being 7 years or 6 years, right? Because some people have taken advantage of paying during residency. So they may not have a full 10 years. So my job is to support Julie's efforts by saying, okay, I don't have any fancy strategies on how to maximize the planning. But what I can do is get your employer to help, right? So let's find some other money from your employer to help pay down that debt balance.
Sure.
I think that's such a good point, Ethan. And honestly, I think with the environment that physicians are working in and entering, like post-residency now, they have a lot more leverage than they probably imagine they have, because people want good people to be working right now. Well, always, but especially right now. And I wrote down, in terms of things that you should be excited about. For sure, what are my loan options? Because, you've invested a lot of time into your education and a lot of money into your education. And so to be able to know that you have, options for that, like Ethan was saying, is wonderful. I also think now, okay, this is the advisor in me, so this isn't going to sound sexy at all, but if there is a Roth option available within their benefit package, that is just, like we always say, Roth is one of the few gifts that the government gives us. And so if you have an opportunity to take advantage of that, that is something to get excited about, especially over, a term of a career. Not that you should invest fully, like all of your retirement in Roth, but it's a wonderful tool to have in your tool belt. And so Roth is super important. I think the other thing that often gets overlooked and is little known is income protection. And so when we work with early stage career physicians, we really teach a lot about how to protect your income, because again, you've invested more than a decade usually of your time becoming what you are at this point, and a ton of money. And so if something were to happen and you got sick or injured, most health systems would offer like 60 to 66% coverage for you if you couldn't work for a period of time. But there are things that you can put in place to make it so that you aren't missing out on any salary. And so that could even be potentially a negotiating tool that, your employer might cover a supplemental policy for you. You just never know. And so they're not sexy or, like super flashy, but things like Roth, like income protection, like student loan forgiveness are things that are just going to like lay the groundwork for a really, really successful path ahead financially.
So, Julie, personally, I think Roths are very sexy. But I did not
I'm
think
glad
they
to
were
hear that.
sexy or even understand what the heck they were when I
Yes.
was in my 20s and still in my
Yes.
doctoral program and for psychology and trying to figure out like how to pay for groceries. I wasn't really thinking about Roth. So could you explain just for a second in case there's someone going,
Yes.
Roth, right? I should ask about Roth for sure.
I've heard of that, but I don't know what it
the heck
is.
is a Roth? Yeah. Could you
Yes.
tell me why that's a great thing and why it is sexy?
I would love to. It is sexy to me. Yes, I agree. But so Roth is a retirement vehicle that is tax advantaged. So you have kind of two traditional systems in America. You have 401ks and you have Roth IRAs. And so in a 401k situation, all of your money that goes in now, you get to put in without really paying tax on it now in a 401k. Then when you retire, once it's time to start taking money out of that 401k, you pay tax when you retire. A Roth is just the opposite. You pay tax today on the dollars that you invest, but then that Roth money just grows and grows and grows tax-free. And when you retire, there's all sorts of special pieces of it that are wonderful when you retire. You don't pay tax on it when you retire, when you use that money. Oftentimes, too, Roth vehicles in retirement are not subject to what we call required minimum distributions. And so you can use that money as you need it without consideration from anybody else. It's really probably one of the most flexible tools we have. And I will say the other most amazing part about Roth is that, let's say at the time that I know this is kind of yucky to think about, but at the time that you pass away, let's say you still have $1 million sitting in a Roth account, that can pass tax-free to your heirs without any time limits of use. Whereas if you have money sitting in a 401k or a traditional IRA, that money has to be used within 10 years and is taxable. So it's wonderful for a lot of different reasons.
Yeah. So I always think of it as like the thing that helped me understand it is like pay the taxes and take the hit when you're young. You have a guaranteed income, you have pretty good health, and you have wiggle room, rather than when you're older, maybe your health is uncertain and you don't have that guaranteed income.
Are you tired of drowning in medical licensing paperwork? At Blue Shift Medical Licensing, their goal is to make your life easier. Let their expert team handle everything from the paperwork to tracking renewals. You can relax knowing your licensing is in the hands of certified professionals. And here's the best part. Mention this podcast for a 5% discount. With Blue Shift, licensing has never been simpler. Find them at blueshiftlicensing.com.
So, Ethan, any other weird or crazy things you've heard of people being offered or new things that people are trying out? Have you heard of anything?
I think those are a couple of the really big ones. Like Julie was saying, I see a lot of my rookie doctors doctors coming out of residency and fellowship, thinking more about lifestyle. And so when we're prioritizing their contract discussions, it's really on how do we find a balance between the money, the support, the expectations in the clinic, but also the doctor having side hustles, being able to, manage their own IP, intellectual property. So
That's
those are
a big one.
I see that quite a bit more so than maybe 10 or 15 years ago working in hospitals.
Yeah. So some hospitals, just to highlight what Ethan's saying here for the listeners, some hospitals or healthcare systems may ask you to sign that if you are developing any kind of intellectual property, they will get part of the revenue of that intellectual property. In some cases, I've seen it be up to 90% of the revenue, seeming that you're developing these products or ideas while you're being paid by them, right? So definitely want to look closely at the verbiage in those contracts, because a lot of this generation coming up now, they have these amazing ideas and they're thinking very tech savvy, and it's much more likely that you could start up a IT company or a med device company from the grassroots. And you just want to make sure that if you have those great ideas that you benefit from them. So
Exactly.
a couple other things I'm seeing, we had on another show, and in this season, we talked with some healthcare organization in Minnesota that has a concierge program. And they have like a personal assistant, and the doctors can ask this personal assistant to help with booking things, looking for help for their parent who needs medical care, or booking vacations, or online shopping, or comparing prices on cars. I mean, that's pretty awesome. I think that's pretty neat.
That's amazing. That's amazing. I want
It
that.
really is. I was like, I need one of those. So just know that I think there are really companies that are stepping up, looking forward thinking, and getting excited about trying new things. And, maybe just the things that worked and were exciting for one group of people, priority shift, and maybe we need to shake that up a little bit. So there are companies asking and offering really cool things, and we want to, just listen to those things, or not be afraid to say, hey, I'm hearing from other companies that this is being offered. Is that something you all are considering? Or if you're with an organization, saying, hey, did you know that some other companies are doing this? And not just saying, I'm a big fan of collaborative decision making rather than we're adversarial, like it's the physicians on one side and the administration on the other. I think it's okay to say, hey, listen, I hear this organization is offering that. Would it be possible for us to get a look at their financials and ask them, have you benefited financially from investing in this program? We're thinking about it. And in this case, this person told me that their retention rate had gone up, and they felt like they had more than covered the cost of that benefit for their staff. So kind of a cool thing. So, Ethan, how can a physician successfully reintroduce salary negotiation if you're like already in a position?
This is the biggest misconception for experienced doctors, I think, of all of the misconceptions out there. It's that doctors who are in practice now can and should ask for a salary raise now. And the reason for that is because if you wait until, I hear this all the time, my contract's coming up in 90 days, or it's coming up in the summer, I'll do it then. If you do it then, you are going to have your lunch taken. And the reason for that is because I'm skilled enough as a hospital executive to talk you slowly into not making any changes by the contract expiration. So here's the blueprint for doctors who are in their practice to get a salary raise right now. There's 3 steps. Step 1 is you pull your stats. So you need to know, how busy are you? What is your economic impact to your employer?
Okay.
I only worked for nonprofit faith-based institutions, and they all know these numbers down to the dollar. Doctors don't. I know that my specialists are generating more than $1 million in revenue on an average basis per year, and my surgeons are north of $2 million. Doctors don't know that. So first, you pull your stats. Secondarily, you must get a competing offer. This step is necessary and required, because if you don't have leverage, you are going to have a bad time. The example that I often use is when I worked on the hospital side, Dr. Smith would come into the office of the CEO, stomping around and say, hey, I heard that Dr. Jones just got a salary raise. I want one too.
Right.
The CEO would talk in circles until eventually Dr. Smith, in the same frustrated huff, would leave the office with $0 in his pocket additional, and the CEO would high-five me and say, we got another one. So secondarily, you must have an offer. There must be a threat to my wallet as a hospital executive that you could leave. You don't have to leave, but you must have an offer. Okay. Third, you go to your employer and you say, I'm grateful for being here. I want to stay here. In order for me to do that, there's a few changes I need to my schedule, my support, or my compensation package. Spoiler alert, they're going to say no. That's when you say, I understand that there's restraints. Just so you know, I've been offered a position at insert hospital name here across the street, and I'm thinking about taking it.
Mm-hmm.
Then the tone is going to change. Now they're going to say, okay, what do we need to change in order for you to stay? But that threat, that pressure, that leverage must be real.
Mm-hmm.
You cannot walk in with a theoretical, I might go somewhere else. I've seen that 1,000 times.
Mm-hmm.
So I tell it's primarily my surgeons who think that they can go in, throw their weight around, and then, get their CEO to move. You must get a competing offer, and that will guarantee you success. Success in either getting better support resources and schedule where you are, or getting it somewhere else.
Yeah. So I'm hearing you need data, you need a backup plan, and you need specific asks.
Exactly.
Okay.
Perfect. I'm going to use that. Data specific.
You can write that down. Data, backup plan, and a specific ask. So, all right, just some closing questions that I like to ask everybody, just to highlight the benefit of truly living and practicing on purpose. So, Julie, what is your greatest passion or purpose? It doesn't have to be work related.
I think for me, family comes first. It was the reason I left my old position and why I am really, really, really loving being in advisors, because we can do all of the supporting and the teaching and the guiding to get other families and, individuals to where they want to be. Mm-hmm. And I came from extraordinarily strong women. My mom and my grandma are phenomenal examples to live by. And so trying to be that for my own 3 kids and for the women that I serve feels really good.
And are there any deliberate things you're doing to stay connected to that purpose?
Oh, for sure. So, it's funny. There are not very many female financial advisors. So I love being one of the only women in my own office. And I think we make up maybe 10% of the workforce in total. So being able to be a voice for other women, 70% of the women in America are the decision makers in their household. So we have a wide audience. And I think women listen differently. No offense, Ethan, love working with you. He's fine. But we listen differently. We relate differently. And I think for me, being able to connect with women in my practice that way is like primary. And then on top of that, just a lot of the teaching opportunities, I think, is how I still use my teaching skills from my previous life. And I'm excited. There's some really awesome opportunities coming up at the Women in Medicine Summit and things like that. So just trying to kind of increase our reach and get the word out about how to be informed and how to be empowered is really my purpose.
And it sounds like what you're doing right now really helps you stay connected to that and aligns to your purpose. So good for you. Mm-hmm. Thank you. So what's next for you, Julie? What's your next goal?
What's next? Well, continuing to just meet more and more people and grow my own financial advising practice in terms of like what's next work-wise. I have a pretty cool national call coming up with a big med tech company. The Women in Medicine Summit is coming up, and just some other cool things that are in the works that way. For me personally, what's next is golf season is upon us, and I started a women in business golf clinic, and so we're getting that off the ground and starting foursomes soon. So I'm excited for that. And my kids, just keeping me running around and busy.
Right.
So.
And I think this women in golf thing is so cool that you started, because so much data says that the big deals are done on the golf course. So you started this group to help women learn to golf so that they can be in
we don't miss out.
the course where it happens, so to speak, right?
Yes, exactly.
Great. So what about you, Ethan? What is your greatest passion or purpose?
My passion is education. And I say that both in the context of my work, my personal life. In my personal life, I'm a basketball coach at the high school level. And so I love teaching the game of basketball to kids. I love that. And the process of seeing things click for them. And then on the business side, I dedicate so much of my time to educating doctors on how to do this for themselves. This weekend on Saturday, I was with the National Medical Association up in the mountains here of Colorado, educating their physician members on how to be paid fairly for their work. So that's work that I do as a passion project. It might be working me out of a job, but I see it as worthwhile because I believe that doctors do deserve to be paid fairly for their work.
So you're doing a lot of concrete things to stay connected to your purpose. And that's the point. Part of the point of this podcast is just to illustrate and feature people who have found a way to do a job that they like, that they get paid fairly for, and that they, challenges them intellectually, but also keeps them passionate and excited. So what else in your work currently aligns with your purpose, Ethan?
Yeah, I love when I have the opportunity to talk with a doctor in their lowest point. And it's not because of the fact that I relish in that experience. It makes me incredibly sad. But what it also reminds me of is like, if that doctor wasn't talking to me, who would they be talking to?
Right.
And when that doctor called me and her salary got cut in half, my first thought was, okay, like I want to fix this, right? But what actually happened was it's like the financial piece is one small piece. Yes, you need a financial advisor. Yes, you need me to help you renegotiate your contract for better compensation. But more importantly, you need a guide, a coach, physician coach specifically, who can help you avoid this pitfall in the first place. Mm-hmm. And so I think of the three of us on this call as really the support system that has a 360-degree view of doctors. And, Dr. Eull, there's so much that you probably experience with doctors that has nothing to do with, the compensation piece, but yet the doctor feels disposable, discouraged, almost as though they're just a cog in a wheel in some cases.
Right.
And so I love when I can talk to a doctor in that position and say, you matter. You deserve better. You didn't deserve what they did to you.
Mm-hmm. So what's next for you?
My dream, like when I think of what RMPA becomes, my dream is for doctors to have representation in contract negotiations the same way a movie star does, the same way a professional athlete does. You don't wonder if Johnny Depp or Brad Pitt has an agent negotiate their contract. You know they do, right? You don't wonder if, in Julie's case, Giannis has an agent negotiating his contract. You know he does. Mm-hmm. And I want representation for doctors having agents to be as ubiquitous as we see in the movies in professional athletics.
Yeah, I actually have a friend who is a chief scientist for a large professional basketball organization. And they provide things like, private chefs, nutritionists, exercise physiologists. They have financial planners. They have psychology, mental health support. And I think, if they provide all these things for someone whose real job is to play basketball, why wouldn't you provide those things for someone whose real job is to save lives, right? Yeah. So the analogy, I was just thinking how I used to give a presentation where we sort of compared those and that it's okay to ask for other things. And I really appreciate you bringing to life that it's not just really about the numbers, it's also negotiating a lifestyle and expectations and demands and all the things that go around what create a meaningful career for people. So thanks to both of you for coming. Ethan, if they'd like to know more about you or find you, where should they look?
First and foremost, check out our Instagram, Physician Agency. And then we have a ton of education on our growing YouTube channel, The Doctor's Agent on YouTube, The Doctor's Agent.
Okay. All right. And Julie, what about you? Where should they find you?
Oh, absolutely. And thank you for having us too today, Dr. Eull. So I am quite active on LinkedIn. You can find me there, Julie Schmidt. My Instagram is Julie Schmidt NW for Northwest Mutual. And I truthfully don't check my Facebook very often, so I'm just going to give you those two.
So don't go to Facebook to find Julie.
Don't go to Facebook to find me.
Yeah, both Instagram people. All right. So thanks so much for joining us for this chat. I think we had some really great information, and hopefully people will find this really useful when they're considering how to negotiate their first salary, renegotiate the salary that they have right now, or as they decide to move to another organization. So we hope this show has you thinking about your own career and what action you can take to make it ideal for you right from the start. If you enjoyed this episode, please like and subscribe and tell others to join us. We greatly appreciate your reviews and comments, which help us grow to a wider audience. If you want to stay in touch, email me at practiceonpurpose@heyinfluent.com. Let me know what topics you want us to explore in future episodes. And remember, build your practice on purpose to stay connected to your purpose. I appreciate you joining us on this journey. Let's keep exploring together. Until next episode.